Hi everyone, welcome to Spine Camp. My name is Alexa.
And my name is Skylar.
And we are recovery care nurses up at Sioux Falls Specialty Hospital.
So you should have received an introduction packet in an email or sent in the mail, just inviting you to Spine Camp class, which is what we're going to be providing you with today if you can't make it to the in-person class. So first of all, some of our goals is to provide you with valuable information regarding your surgery, what to expect before, during, and after surgery, and how to best care for yourselves during that process. So some individuals that will be on your spine team include your surgeon, their assistant, which will be either referred to as a PA, which is a physician's assistant, or an NP, which is a nurse practitioner. The anesthesiologist, they'll be the ones that will discuss with you how you'll be going to sleep during surgery and what methods they'll be using and what methods they'll use for pain. The hospitalist or medical doctor will come around after surgery and check on you as well. You'll have your registered nurse and your nursing assistants, the discharge planning nurses, and then physical therapy and occupational therapy will also be coming around and working with you through this process.
So preparing for your surgery. So preparing for surgery, there's a few things you do need to do before even scheduling for your surgery, such as a pre-op history and physical, mainly with your primary doctor. We usually like to see that within 30 days of surgery or sooner. Once you have that done and we schedule you down for the surgery, 2 to 3 days before that day, you'll receive a couple calls either from your insurance, from our insurance company, or registration as well. That again will go over your history, your medications, just confirming everything, and then knowing the time and area that you need to be at on that day. Another thing to prepare for is your home. So meal preparation, having some things set aside in the freezer, ready for you when you get home. Removing the rugs, cords, and other tripping hazards. Having clean bed sheets and having clean towels, as well as clean clothing to wear. Pet and mail arrangements. So if you're going to be here in the hospital for maybe a couple nights, knowing where those animals should be while in your hospital stay, as well as after you come home if they are bigger animals or shed quite a bit. We want to keep that incision site nice and clean. Equipment, so walker, cane, bathroom supplies. If you have any of those, such as like a walker or a cane to help you while you're in the hospital, feel free to bring that in. But you do not need to buy equipment before the surgery because we do have staff here that will help you with acquiring those such equipment. And then preparing your body, that's the other thing to do before surgery. So when we say that, we mean exercising, getting that physical aspect prepared for surgery, having a healthy diet, good weight management. If you do smoke, we do say try quitting smoking a good time before surgery if you can. Doing breathing exercises, so deep breathing at home, getting those lungs some exercise. And then with your pre-op appointment with your primary doctor, they'll talk about this as well, but stopping certain medications. In that pre-op phone call, we will verify that you have stopped certain medications if you're on them, such as blood thinners, NSAIDs, and those will include a lot of like the ibuprofens that can thin your blood. And then again, those NSAIDs you will not be taking after surgery for several months, just because it does thin your blood out pretty well. Shower as directed the night before and the morning of. Usually we do want you to do both, but again, instructions can vary depending on your surgeon. If you do have nail polish on, we do ask you to remove that before coming into your surgery date, mainly because we do have a little probe on your finger that will record your oxygen as well as your heart rate the entire time you're here. And again, In those pre-op phone calls, we'll talk to you about nothing to eat or drink after midnight the night before surgery. Again, we'll give you instructions about any clear liquid diet that you can be on. And then things to bring to the hospital include insurance and prescription cards. Our registration ladies will take those from you and give them back. We just need copies. All labeled medications in the prescription bottles, except your pain medication, you don't need to bring that with you. We will supply you in the hospital with pain medications. Comfortable and supportive walking shoes, because you will be walking around in the hallways and the rooms, as well as walking out potentially and getting into your vehicle. Loose fitting clothing, so something to put over your brace if you have a back brace, something just to put on that's comfortable for you. Toiletries if you're staying the night. Cell phone chargers, so we might be able to have a few to spare, but usually they are gone, but we do have Wi-Fi available in the building. CPAP devices, please bring yours in. With COVID right now, we currently are not necessarily using them unless absolutely necessary. We do have supplies available to help with any breathing throughout the night, but usually CPAP devices aerosolize what's in your lungs, and with COVID, we try to prevent any aerosolizing. And then a walker if you do own one. But again, if you don't own one, don't sweat it. We will supply you with a temporary one at the hospital. And then things to leave at home. So large sums of money. We don't want that here. We don't want to lose it. Valuables, jewelry, vitamins and supplements. Don't bring those in. No need for that. Pain medications, again, we'll supply you with some. And then large suitcases or larger items. Please leave those at home.
So now I'll discuss what to expect that will happen during the surgery. So surgery morning, we'll actually have you try to shower the night before surgery and the morning of surgery if possible, just to help prevent any bacteria from being on your skin prior to surgery. We'll have you take your medications that you were instructed to take during your pre-op phone call, and then we'll have you have nothing to eat after midnight. And during your pre-op phone call, they will instruct you how long you can have clear liquids such as water for up until surgery. We'll have you arrive at the scheduled time at the testing center first. They'll give you the directions for the testing center and your specified time during that phone call. They'll do a COVID screening there. Well, they'll do a smaller nasal swab on you to check for COVID. That will take about 20 minutes for those results to come back. After that is done, we will have you right after come to our hospital here and get checked in with valet, and then we'll have you come in the building, sign in with registration. After that, you'll go back to the pre-op rooms. They'll give you some disinfecting wipes there to use, where they'll have you use from your head to your toes just to scrub off any extra bacteria that may still be on your skin. After that, we'll have you use nasal swabs with iodine on the ends of them, again, for bacteria prevention purposes. Then we'll have you change into your hospital gown and get ready for the surgery. A nurse will be at your bedside and review all your home medications with you and your health history just to verify that it's correct in our computer system. Pharmacy will take your medications that you will bring with you, and they will lock them up in the room that you'll be staying in that night. And your belongings will also be taken and placed in a secure location while you're in surgery as well. The anesthesiologist doctor will come to your room and discuss their options for pain management and how you'll be getting through your surgery with them, and forms of anesthesia. They'll also and your nurse will take your vital signs. They may draw some labs on you as well and go ahead and start an IV. And then your surgeon will also come to your room and discuss the surgery with you beforehand, and they may or may not mark your surgical site. after that, you'll be walked back to the operating room where they will do the surgery. You will be told your surgery time beforehand. It may come a little earlier or later, just depending on the schedule that day, but you'll be informed of that at the time. After you're sleeping, they may or may not have to put an airway in place. Most likely they will. Your throat will be a little bit sore after surgery, and that's normal and to be expected. After which your surgeon is going to call your contact person that day, whoever brought you to the hospital or is with you. So we'll want them to have their phone charged and on loud so they do not miss the call from the surgeon. They will be in the waiting area, and after your surgery is done, your family will be brought up to your room to meet you. Sometimes during surgery, they do what is called intraoperative neuromonitoring, and that just monitors your nerves spinal cord nerves during surgery. When surgery is over with, you'll be brought to the PACU or the post-anesthetic care unit. You may be there 1 to 2 hours, sometimes shorter, sometimes longer, depending on the surgery and how well you wake up afterwards. They'll be taking frequent vital signs on you, so checking your pulse, temperature, blood pressure, all of those. They will be giving you IV pain medications down there, and then you'll also be given warm blankets. You may have oxygen in your nose, and then TED hose, which we have some. These are long white socks that are placed after surgery. They just help prevent blood clots from forming. You may put those on before surgery too. And then you'll have SCDs on, which are sequential compression devices. These are also used to prevent blood clots. When you're laying down in bed, you'll have these on. They just kind of squeeze your legs, kind of like a leg massage. And then if you do plan to leave that same day, your family will meet you in the step-down unit and pick you up so you can go home after surgery. Otherwise, you'll be brought up to your room in the recovery care unit, and then your family will meet you up there in your room.
And then we'll be talking about recovery, so up in that recovery care unit. So upon arrival, usually we get you orientated to the room, let you know kind of where things are and what expectations we'll be doing on the first day. We'll do a nurse assessment, so listening to your heart, lungs, getting vital signs pretty frequently. You'll get reunited with your family. We'll update them if they aren't coming up to the floor. We can always give them a call. We'll get your belongings up to you. If you don't see them in the room right away, just let us know because we can go find them. And then you'll have your own menu, and as well as a visitor meal. Every visitor gets at least one meal. And then the day of surgery, still, like I kind of talked about, activity or expectations. If you have a back surgery, there is something called a log roll that will have you learn and do each time you want to get up out of bed. And it's just pretty much keeping those shoulders aligned with those hips, rolling to your side, and getting up while keeping a straight back. We'll have you walking within the first 6 hours. A lot of that walking is good for those back muscles, keep the pain relieved. Up to the bathroom. Some people may come out of surgery with a Foley catheter in your bladder. That pretty much just keeps everything flowing. That does get usually removed the next morning, but always talk to your doctors, see if you do need one or will get one. May see physical therapy this same day. They'll be the ones who help you move correctly, as well as the nursing staff. Walk as tolerated with staff. So again, that walking is really important. That's going to be the best thing for you after surgery. You might need to use the walker that we talked about, and then you will always have to have a gait belt on. That's one of those belts that staff can kind of hold appropriately on you. Short, frequent walks, again, we want to keep doing that. When you go home, we want you walking quite a bit as well, so just getting you in the habit of doing that. No lifting anything over 5 to 10 pounds, so that's about a gallon of milk. So if you think it's more than 10 pounds, it probably is, and don't lift it. Avoid bending and twisting. Diet-wise, we want you to start you nice and easy. So again, you're not eating much before surgery. There's nothing in you during surgery, and then after surgery, everything's kind of waking up again. So we don't want to throw a bunch of food down right away. So a light meal such as toast, soup, Jello, we have all that available to you as soon as you get up to the floor. We'll probably start you on one of those right away, and then advance as tolerated. So if things are going well with you, you're not feeling too sick to your stomach, we can get you a real meal shortly after. Equipment in the rooms, you might need a little bit of oxygen. Again, things are kind of just waking up, so you might need a little bit of supplementary oxygen just to help those lungs out. A heart rate monitor, again, no nail polish because we'll have a finger probe on your finger looking at your heart rate. You'll have an IV still going, still running, so expect to have that IV in your hand, your arm, wherever it may be placed until you go home. A bandage on your back, there'll usually be a nice dressing on your back, and we might have to change that before you go home. You may have a back brace ordered depending on what surgery you had. If you do have one ordered, we'll fit one to you in the room, and before you get up, we'll have that nice and fitted on you, and then you'll be able to take that home. You might have a drain placed on your back or wherever your incision site is. It could be called a hemovac. That is usually one of those bigger drains, and that just helps with alleviating any pressure that might build up after surgery. Or you might have a JP drain, and those are a little bit smaller, usually happen with those smaller surgeries. If you have either one of those, they do need to be removed before you go home. And then again, we'll have those sequential pumps on your legs that are squeezing. You'll have the TED hose still on those legs, those long white socks. You might be given an ice pack on your back. Again, always ask your staff if you're able to have those. So an ice pack might look like so. You might have a smaller one. Just depends on what your incision looks like and how you're feeling. Another thing that we'll give you right away is called a Volurex or an incentive spirometer. This is going to help prevent pneumonia and work those lungs during your stay at the hospital. You're not going to be as active and easily moving as before, so having this and working on that breathing techniques will definitely help in the long run keep you very active and keep things moving in those lungs. And then again, a walker if you need it. And then it's still in recovery care, post-op day 1 is what we call the day after your surgery. You'll have visitors, quite a bit of people coming in to see you that day. So you'll continually see the nurses throughout your stay. But physical therapy will most likely see you this day. They'll get you up, get you moving, walking up on the stairs. They'll be the big ones to tell you if you're able to go home or not, because we want to make sure you're safe. Occupational therapy as well, you might see them. They'd be the ones who would help you with any supplies that you might need at home. Discharge planner, if you haven't seen them already, they will just verify everything with you if you're going home. If you do need additional assistance at home, they'll be the ones to talk to. You'll see the doctors or the physician assistants. Remember, they kind of work together. You might see one of those the day after surgery, just checking in on you, see how you're doing, if the pain medications are working, and what you need at home. And then you'll see the patient care techs as well, mainly with the nurses. They'll be working together throughout the night. And equipment, so those drains I talked to you about, those will most likely be taken out before you go home. And that again depends on how much is draining out. Your IV will be taken out the day after surgery, or when you go home, and then the Foley catheter will usually be removed the day after your surgery as well, so then you're up and going to the bathroom on your own. Labs may be drawn the day after surgery. Those are usually pretty early in the morning because we want those done and resolved before the doctor sees you, so they kind of know too. Activity-wise, again, ambulating or walking in the hallway. We're going to practice stairs with PT like I said. We'll change that dressing if it needs to be, and then begin to prepare for your care at home.
So some information on meeting your discharge criteria or things that we would want you to accomplish before you go home would include that your pain is well managed throughout your stay. We want your pain to be managed at home. You will expect to have some pain. You will not be pain-free, but we want it to be managed and not be an uncontrollable pain. We'll want you to be eating and drinking fine before you leave, and able to go to the bathroom, void fine and passing gas. And then therapies will work with you, and they'll say whether or not that you pass therapy or not, or if you're able to walk fine around at home well. And then if you do have a drain in place, we'll monitor how much is coming out of that drain. And sometimes people may need to stay a little bit longer if there is a large amount of output coming out of your drain. Generally, most people are able to discharge the day after surgery. Sometimes people do need to stay a little bit longer because of those reasons we just went over. So regarding pain management, your nurse will be coming into the room frequently and asking you what your pain level is on a 0 to 10 scale. 0 is no pain and 10 is the worst pain imaginable. So your nurse will be giving you pain meds and seeing what works for you and how we can keep that number at an acceptable level for you. Let's see, you'll want to be proactive with your pain medications or staying on top of it is what we like to say. So just not getting too behind. Generally, most people can take their pain medicines about every 4 hours, but each case is different. Other things we might like to use would be like ice packs. Those help with pain. Well, they help with inflammation and swelling, which in turn helps with pain. Some of the pain medications that we may be using include narcotics such as hydrocodone, oxycodone, Dilaudid, Nucynta, and Tramadol. Some of the side effects for these medications, the biggest one is constipation, so having some stool softeners at home is really going to help you in the long run. Other side effects may include nausea, dizziness, drowsiness, and itching as well. Non-narcotic medications may include Tylenol or different types of muscle relaxers, which may be able to help with pain. And then we'll have you not do any driving or operating heavy machinery while you're on the narcotic pain medicines. So like I mentioned before, you'll want to have stool softeners at home, and we may give you some while you're in the hospital too. Some popular ones include Colace, Miralax, Fibercon. There's a lot of different stool softeners that you're able to get at any pharmacy. Some of those side effects may be abdominal cramping or diarrhea. And then while you're in the hospital, we'll have you taking some antibiotics. You'll usually get 3 doses in the hospital, 1 during surgery and then 2 after surgery when you're up in the recovery care unit. And this is just for prevention of infection. Usually it'll be, the most popular options are Ancef or clindamycin, and some side effects of those include rash, itching, flushed face, and nausea is a big one, so trying to eat some food before you get these antibiotics will help.
And then the final step is when you start going home. So discharge planning. You will be seeing a discharge planning nurse. She'll come around and discuss with you kind of what you expect at home, what you can and can't do if you need help. They'll visit with you the day of or the day after surgery regarding your needs and plans for home. They'll assist with ordering equipment if you need it, and then with any discharge needs. So like I said, home health, whatever you might need to help you recover. And make sure a big one too is choosing a vehicle that is easiest for you to get in and out of at discharge. So if you do have a couple of vehicles and you can, kind of figure out which one is a little easier for you to get in and out of. If you're a tall gentleman, maybe a shorter car is not the best thing for you. And if you're a petite little woman, you might need that short car then and not a big pickup truck. So use your discretion with your vehicles. And then going home again, discharge instructions. So usually you'll have an appointment with that surgeon a couple, maybe a week or two after surgery, just to see how things are going, take out any staples, any sutures that you might have. Medications, they'll send you home with some pain medications and maybe even a stool softener. Usually we don't send you home with any antibiotics. Incisional care, we'll give you some dressing supplies. Signs and symptoms of infection, we'll go over that with you at discharge, but again, if you have any redness, swelling, pain, odor, pus, if you start having fevers, those are big signs of an infection, so be careful of that. Again, with the dressing supplies, we'll only give you a few, but if you do need some extras, the pharmacies should be able to provide you with some, but if you, before even going in, maybe give them a call to see if they do have those supplies ready. Showering, make sure you cover your incision site at home. We don't want you we don't want your back hitting the water directly, so facing the water when you do end up showering is very important. We don't want to soak that area. Again, do not submerge or soak the wound, so no baths. Make sure you're not just sitting in water. No hot tubs, baths, pools. Activity-wise, again, those short, frequent walks. No bending, twisting, or lifting still, and no lifting more than 10 pounds. And then medication refills, make sure to call your surgeon office. About 4 days before running out. It does take a while to go through your insurance and then to validate the reasons why you need those pain pills at your pharmacy. And then discharge planning continued. Please plan to discharge home. People typically do very well after surgery and usually are safe to discharge home. But again, everyone is different, everything varies. We try to take you and your family's preferences into account. If swing bed or home health services are medically necessary, we can help you set these services up while you're here in the hospital. And no matter how prepared you are for home, it will be an adjustment. You will likely experience anxiety and may question whether you are ready to go home or not. Be assured that this is a normal feeling. We will do everything we can to assist you with this transition. You got this, you can do this. Please don't compare your surgery to anyone else's surgery or even to previous surgeries that you've had in the past. Each surgery is unique and each person heals differently. So again, thank you for choosing Sioux Falls Specialty Hospital. We do have some frequently asked questions that a lot of people have regarding surgery. So we'll kind of go over some of those.
One of the questions includes, what if I live alone and I don't have anyone to help at home? So we do recommend trying to have a friend or family member being able to stay with you for the first 1 to 2 days after surgery. We would want them to at least be able to check in on you several times throughout the day in person, and you will need a person to drive you home as well. So if you do not have anyone at home, let them know in the phone call or even before surgery so we can try and get something set up for you. Another frequently asked question is, what will I wear in the hospital and what clothes should I bring? So you'll be in your hospital gown for the majority of your stay, but we will want you to bring some comfortable, loose-fitting clothing with you to the hospital, and then some shoes, just in case your feet start swelling a little bit. That may happen after surgery. We'll want you to bring looser-fitting shoes as well, such as sneakers or slippers or something like that.
With a good bottom to them.
Yeah.
Another question, will I need to go to an inpatient rehab facility such as a swing bed or skilled nursing facility after surgery, or will I need home health? Our patients usually do pretty well. Usually go home afterwards. But if you have any questions regarding inpatient rehab or any of those services, feel free to contact our discharge nurses. There is a phone number provided there, 444-8205, if you do have any questions or believe you do need something like that after your surgery. And then when can I resume my daily activities? So this is a good one. You can increase daily activities as tolerated within your doctor's guidelines. So you will go home with instructions saying what you can and can't do, any restrictions, and for the most part you can keep going as tolerated. But again, every surgery is different.
When can I return to work or hobbies? That is kind of more another specific thing to you that you'll want to discuss with your surgeon as well, regarding, you know, how fast it will take to heal and when you can go back. And it also depends on what you do for work, so you'll want to bring up that as well. When can I resume housework and yard work? A lot of these activities can be very hard on your back, so if possible you'll want to have someone else be able to do the household chores and yard work until you have fully recovered. And you'll want to ask your surgeon and make sure it's okay as well.
Do I have to do therapy exercises at home? No, there is no prescribed exercises upon discharge. Just make sure that you're walking pretty frequently. This is one of the best ways to heal and strengthen your back. It will also aid in relieving those muscle spasms that you might get. We'll have pain medications to take home. A prescription for pain medication will be e-scribed to the pharmacy for your choice. Sometimes they even give you a paper script for your pharmacy depending. And then will I be on antibiotics when I get home? Typically you will not go home with a prescription for antibiotics. You will receive a course of IV antibiotics while here in the hospital.
When can I drive? So you'll want to talk to your surgeon about when you'll be able to resume driving, and we will not want you driving while you're on the pain medications or narcotics as well, because it will impair your judgment and ability to operate your car. When will I get a call from the hospital before surgery? So this will be that pre-operative phone call that we discussed earlier, and it will usually happen between 1 and 3 days before your surgery. They'll want to verify your medical history and the scheduled procedure time to arrive. Is there a place close by for my family to visit while I am in the hospital? So one family member may stay with you in the hospital at this time. However, if there is more family or you live far away or something like that, we do have the Center Inn hotel that is attached to the hospital, and their number is provided there as well, 605-334-9002, to call and make any reservations that you may need.
So thank you guys for choosing Sioux Falls Specialty Hospital. We can't wait to meet you. If you do have any questions or concerns, you can always visit our website. There are phone numbers, email addresses that you can contact us with. Again, take care and wish you the best.
Thanks, guys.